I'm Florian Tode, Professor of Endocrinology and Diabetes at the University of Medicine in Tirana and Chairman of Diabetes Education Study Group. I'm pleased to welcome you to these highlights of the 54th EASD Congress in Berlin. This year, the EASD meeting is offering an exceptional educational opportunity in the field of diabetes research, treatment and care. In this Highlights program, we are proud to offer a selection of the newest and most relevant topics arguments. The Highlights format of the conference includes summaries and interviews on diabetes prevention, education, epidemiology, hypoglycemia management, liver and cardiovascular disease, diabetes, combination of therapy, obesity and aging, as well data from the following studies. And I sincerely hope that you enjoy this educational opportunity for all healthcare providers committed to the care of people with diabetes worldwide.
The 2018 Consensus Report is an evidence-based, pragmatic approach to the management of hyperglycemia in type 2 diabetes.
The real take-home message for the new consensus statement, it gives you a blueprint and an outline to consider all the patient factors that are necessary to arrive at the individual target for A1C.
We're at the EASD in Berlin, and we've just presented the position statement for management of the elderly in terms of glycemic control in people with type 2 diabetes. This is a Primary Care Diabetes Europe consensus statement that's been developed with a group of individuals from primary care and also specialist care as well. And we're hoping that this position statement will be published soon and it will be valuable for primary care to manage their patients more holistically.
There are two most important things that needs to be done, especially in the high-income countries, and these are the high-risk identification, and we have tools for that. But the other thing is to actually work with the other sectors outside the health sector in the community.
For about 10 years, there has been lots of excitement that polyagonists combining hormone action in a single molecule may work. Today, we have seen translational data that indicates that that may actually be true.
So NAFLD is a condition which ranges from steatosis through NAS to fibrosis and cirrhosis. It is a condition which a diabetologist should be aware of, but is frequently underdiagnosed.
I think that the microbiome is a forgotten organ which consists of more cells than we have human cells in the body. And the total gene count is about 1,000-fold larger than we have in our own body. And as such, the altered microbiome may contribute to metabolic diseases. And our interest per se is type 2 diabetes.
We need to validate the inclusion of artificial intelligence in our clinical practice, and I'm sure that the way we approach and we treat patients in the future will be significantly changed by this approach.
The future for the European Foundation for the Study of Diabetes is, I hope, and I'm sure is going to be a very, very good one. Hoping to foster more research in diabetes, and even more, what I think that the EASD will be doing is to try to attract more young people in the field of the research of diabetes.
Thank you again, and I hope to see you next year in Barcelona.